everybody, it's Dr. Jackson over at the Sports Pod, and today I just want to have a little conversation with you about a baker's cyst. So not necessarily a cyst that a baker would have, someone that cooks bread and does all that good stuff, but a baker's cyst is actually, a cyst or an irritation or a swollen bursa at the back of your knee. And I'm going to talk a little bit about that today and hopefully, educate you on maybe some of the causes of like knee pain or maybe like calf pain or cramping in your foot. So pretty much in a previous video, I explained about, bursas, what is a bursa, what is a bursitis, and we talked about the knee. And if you remember, I said that there were 14 bursa in the knee. So there's actually quite a few at the back of the knee. And if you're familiar with your anatomy, you know that basically your calf muscles, two of them, so the medial and lateral calf actually come up and cross the back of the knee joint, and then your hamstrings actually come down and cross the back of your knee joint. There's also a structure in there called your popliteus muscle, which kind of spans the back of the joint, and it's there to pretty much lock and unlock the knee. Now, there are bursa pretty much between all of these structures. And if one or more of these bursa gets swollen or if it gets, inflamed, this could cause you to have like a noticeable lump or maybe a palpable mass, almost in the back of your knee. And this is what we would call a baker's cyst. So, how do you get a baker's cyst? Is it something that, will go away on its own? Is it something that, I need to get surgically removed? And, I don't believe you need to get it surgically removed. Pretty much you just need to reduce, the irritation in that area. And then also work on, improving your range of motion. And that'll help to kind of clear it up. So, some of the symptoms, involved with the baker's cyst are going to be, like a fullness, or a pain at the back of your knee. Maybe you feel pain when you go from like a fully flexed, knee and you're extending your knee. So pretty much it's straight, or it's like really bent, and then you go to a straight position and it's kind of stiff or painful. That's also an indicator that maybe you've got, some sort of, inflamed bursa or cyst back in the back of your knee. Also, you can experience some pain into your calf, or maybe even pain, or like cramping sensations in your foot. And the reason you would get that is because your sciatic nerve comes down the back of your leg, and then right at the top of the knee, it splits, and you got a couple of different branches. And one of those is going to be like your tibial branch or your peroneal branch. And if the bursa is inflamed or swollen to an extent where it actually like puts pressure on that nerve and irritates it, you can get shooting pain into your calf, maybe cramping, burning sensation in your calf, or cramping down into your foot. So that kind of helps explain, why you would have those symptoms. Pretty much a good way to kind of help alleviate this is to go ahead and do some soft tissue work into your hamstrings, but also down into your calves or your gastrocs. This will take some of the tension, out of those muscles and help take some of the pressure, off of that bursa. Also, rest will help, reducing some of the, range of motion there, and just kind of easing your way back into activity will help as well. But also helping to kind of flush out the inflammation and the fluid. So you can do that through like, self kind of massage, or just, keeping your leg elevated and letting gravity take over and kind of flush that out. Because that congestion basically is the main cause of that pain, right? Because there's only so much room for that fluid to build up and go. And when there's nowhere for it to go, everything gets tight and stiff. And that's part of the reason why the range of motion is, decrease. So try to get that out of there as soon as possible. That should definitely help. That's pretty much it. Baker's cyst in a nutshell. Hope you guys learned something here today. If you have any questions, go ahead and contact me via social media. Once again, my name is Dr. Jackson at the Sports Pod, and move free.